Hello, this is Dr. Gay from First Look MRI, and this is a 61-year-old male who complains of knee pain. He has tears of both of his menisci that explain his symptoms. So this is a tear of his medial meniscus root over here. The posterior horn comes across, root tear. He also has an undersurface tear of his lateral meniscus or undersurface degenerative fraying gear. So we know why he's having his knee pain, but he also has some patchy abnormal signal down here in this tibial shaft or tibial diaphysis. A little bit up here, this is clearly physiologic. It's very hazy and uniform, does not look pathologic at all. But down here, this is more splotchy and it's more hyperintense, so this is a little bit more worrisome. So in a patient who's 61, normally they will not have any active red marrow. This is probably just patchy active red marrow. We call it red marrow reconversion. When we're young, we have active red marrow in the shafts, and over time that goes away and it's replaced by fatty marrow that's very uniform like this. It should be low in signal. There's a fat suppressed sequence, so just like the fat in the subcutaneous soft tissues, this low in signal, the fat throughout the marrow space should be low in signal. So this is bright. So we call this red marrow reconversion. It's converting from the fatty marrow back to active red marrow. We can see the same thing on this. This is a scan where fatty marrow will be bright. So the subcutaneous fat is bright, the fatty marrow is bright, and over here it's not bright. This is the area that we're concerned about. So very common to see areas of patchy marrow, and it makes us a little bit nervous because things can cause this that are pathologic. So myeloproliferative disorders like polycythemia vera or thrombocytopenia or myelofibrosis or even leukemia can cause the marrow to become active and cause little patchy areas like this. This is very mild, and so I don't believe this is related to myeloproliferative disease, and more likely something that is benign. And when we think about this, benign conditions, one of them is high altitude. People who live at high altitudes can have active or red marrow reconversion. They'll get little red marrow arrest sometimes in the femur or tibia. People who smoke can have red marrow. Maybe that's one of the more common things to see. So we'll mention that this could be related to red marrow reconversion from smoking or from physiologic stress or living at high altitudes. And another thing that can cause this is anemia. So anemia for any reason can cause the red marrow to become active to compensate. And so we throw these all out there. This is likely benign and correlate with history to see if they're a smoker, if they have lived in high altitude, and then throw out the remote possibility that a myeloproliferative disease is not entirely excluded, and they will have to do clinical assessment and then sometimes even blood work to make sure they don't have anemia as the underlying cause. And that's it. Thank you so much. A very common finding we see patchy marrow with the differential considerations listed above.